morning. Do you mind if I grab your name real quick? Okay. Your date of birth. And do you remember your ID number? Okay, good. So I've got the right person. It's always a nice little surprise. So it looks like we are doing a full blood panel on you. So we're doing a little blood draw. Okay? So how are you feeling today? Little woozy, little nervous? Okay. So they did have you fast 8 to 12 hours beforehand, right? Yes. Okay, good. Yeah. For most blood draws, you don't need to do that. They're usually done while you're still at the doctor's office, but for this one, we just want to make sure. Okay. So I have some little snacks afterwards so that hopefully it'll take the edge off. Okay. Alright, so before we begin, I just want to kind of discuss with you a little bit about what we're going to be doing, okay? Hopefully alleviating a little bit of stress, making this a little bit of a better experience for you. So I am the chief phlebotomist on the floor, okay? So that's just a really special name for I'm the licensed technician that conducts blood draws, okay? I've even got this really cool name tag, okay? Chief phlebotomist, totally certified. Okay, so what that means for you is I've had quite a bit of experience and I know what I'm doing. So this should be a pretty smooth process for me and for you, okay? So I'm going to sanitize my hands real quick, kind of make sure my little box of wonders is all organized. Okay, looks like I have everything. So, do you happen to be a person who has a tough time getting your blood drawn? Do you feel usually pretty stressed out, nervous, jittery, anything like that? Get faint at all? Okay. Well, while you're here, I'm going to talk a little bit with you about some tips, some tricks that will help you out, it'll help me out. Okay, just make this, all in all, just a pretty good, normal experience, okay? So, first, we've already just talked about, you want to let your technician know if you are particularly bad with getting your blood drawn. I know I am. I'm absolutely terrible. I get really faint. I start panicking. A lot of times I'll get panic attacks. I mean, it's always been a really bad process for me, but I have been able to find someone who really makes it a very easy process for me, so I tend to go back to the same place because they already know I have issues with it, and they're really good at helping to alleviate them. Okay, so for example, if you get faint quite a lot, or if you're just in general kind of panicky, what we can do is, well, and what I'm going to have you do is I'm going to have you lay back, okay? So this helps that if you do get real dizzy, if you get real faint, that we're not going to have you tip off the edge of the bed. That'd be really bad. Okay. So I'm going to have you lie back now. Go ahead. Yep. So what we're also going to do is I'm going to give you a little play-by-play of what we're doing, why we're doing it, okay? So I want you to take some deep breaths, okay? We want to really normalize our heartbeat. We want to just make our breath slow and even, okay? just take in a deep breath. Inhale. And just hold it for a second. And exhale. Okay. Deep breath in. Hold it for a second. And breathe out. Okay, one more time. Deep breath in. And hold it. And breathe out. Okay. Alright, are you still kind of nervous? Yeah. It's normal to be nervous. It's ridiculously and extremely normal to be nervous, right? A lot of times we're already thinking about getting our blood drawn and remembering that it hurts and, just kind of in general psyching ourselves out, right? Okay. But luckily, a lot of technicians are very trained in this and they see it all the time, and a lot of them are very good at helping with that. Okay. So, another tip that if you're extremely bad with getting your blood drawn, you'll want to ask if it's possible that you get the, either head blood drawer, phlebotomist, nurse, whoever, to get your blood taken. Sometimes this is possible, sometimes it's not. Okay, everybody's pretty busy. And it may seem like you're really asking a lot, but, on the one hand, the nurses and the technicians, all of them, they're all working very fast, very hard, and we're not always aware of exactly what they see or what they're doing. They might have seen somebody get really hurt or dealing with some really troubling circumstances, so it might seem, kind of a pain in the ass to do, but it makes it a lot easier if you don't have to prick somebody 5 times trying to find a vein, because they keep rolling because you're nervous, and, sometimes we just bite the bullet, we do it, and we do it because it's our jobs. We love our jobs. We love helping people, right? People like you, people that come in, right? And even if it's not possible, you can also ask, if you're really nervous about the pain, if they can do a butterfly needle, if that's possible. So, what a butterfly needle is it's a size smaller, usually, than the normal needle. So while your blood draw is going to take longer, it is a smaller needle, so it doesn't feel as bad. So on the one hand, it's less pain, but on the other hand, it will take longer. Okay? Alright. So we've had this little chat here. I'm gonna go ahead and get some things ready, okay? Just chill out, alright? It'll be over in 2 minutes, 25 seconds, 63 milliseconds, right? It'll be really quick, okay? Alright, just give me a second here. Alright, I'm gonna grab my gloves. I'm gonna make sure this is a very sanitary process. And then I'm going to get a little alcohol swab, and we're going to sanitize the area. Do you know which arm you want me to take the blood from? So I got a little alcohol wipe here. Just going to open this up. And I'm going to take this and just hold out your arm for me. Alright. Okay. So I'm just rubbing at the crook of your elbow, which is also called the cubital fossa. Little fun fact for your day. Okay. Throw that away. Okay. And I'm going to get a tourniquet band. And I'm going to get my needles and things ready, okay? Alright. Okay. So we've got a little rubber band here. A rubber band on a rubber band. And what we're doing with this... There we go. So this is our tourniquet band, okay? And I'm going to be wrapping this rather firmly around the upper arm, okay? So this helps to get a better blood draw. Okay, there we go. I know, it's quite firm. We get a better blood draw from it. It helps the vein protrude more, which in turn, if we don't have to really poke and prod at it, it's much easier for you, it's much easier for me, and there's a lot less pain involved, okay? So now I want to palpate your cubital fossa here, okay? And I'm just feeling for where the vein is, okay? And this palpation also helps make it a little easier on people who have particularly difficult veins. We can warm the area, we can really massage our fingers in there. Okay. So I want you to go ahead and take some deep breaths again, alright? Just get used to this feeling. It'll be alright. Okay. Just inhale, hold it, and exhale, alright? Wonderful. And this will also help so that your veins don't roll, okay? I have rolling veins. They're kind of a pain. Okay. Alright. It looks like you're staying pretty hydrated too. Your veins are coming up a lot easier, which is awesome. Always gotta stay hydrated. It makes everything easier. Okay. So I've got a needle, alright, and I've got my vials. So we're going to do this, okay? So we're going to have a little conversation though, okay? I want you to tell me, if you could be anywhere in the world, where would you be and why? Okay? Alright, so let me get this all done up. Okay, I'm going to put the packaging away here. Okay. Alright, I want you to look away. And I want you to take your deep breaths and tell me where you would go if you could go anywhere in the world. Okay. Alright, you're going to feel a slight prick, alright? Okay, here we go. Alright, yep, see, it's done. Okay. So what would you see in this place that you could go? What would you do there? Okay. Alright, do you have any history with that place, or just really want to see it? Okay, we're almost done. You're doing great. Okay. Yeah? Sure. Alright. You're doing wonderful. Just keep telling me about where would you go, and what you would see, what you'd get to do. Done here. Okay. Pull that off. Take your tourniquet band off. Okay. cotton ball. I'm going to press it here. Okay? I want you to hold on to that while I get some Coban ready, okay? Alright, wonderful. Yep, just hold that cotton ball there. Okay. So I've got some Coban. I love Coban. It's much better than working with the medical tape and gauze. It's a lot of times that sticks to your skin and it's just not fun at all to remove. Alright, there we go. So Coban sticks to itself. It's wonderful stuff. Okay, we're going to wrap this around the wound there. Okay, pull it apart. Okay, you're doing great. Now you can go ahead and take your hands off, and I'll just fasten that real quick. Okay, great. Okay, you can go ahead and sit up when you feel ready to. Okay? Alright, so as you know, we did just put a hole in your arm, so you might notice that you get a little bit of bruising, but the pressure on that cotton ball, the Coban, will help alleviate that, okay? So, a little bit of bruising, a little bit of swelling, but should go down within a couple days, okay? And you'll want to keep on this Coban little sandwich on your arm for a couple hours at least, okay? So there might be a little residual pain, but all in all, you did wonderfully. You really did. So, I have a little treat for you. A little bit of candy. I'm going to take off my gloves and I'll get you a little bit of candy. That'll help with any nausea. It's a mint, little mint, so mint is very often used for feelings of nausea. Alright, here you go. I'll put this in your hand, alright? You know, I think I'll grab one for myself. Getting low on mints, huh? So do you have any questions? Any concerns? Okay, well, you really did quite wonderfully, okay? I'm really proud of you. So, again, a little bit of pain, a little bit of swelling, a little bit of bruising, all that's normal. Alright, but all in all, you're good to go, dear, okay? Alright, just sit here for a few minutes if you need to. And I don't imagine I'll see you anytime soon, okay? Alright, but nevertheless, I hope you have a whale of a day. And a very good night, okay? Alright, see you later.